What if your child was diagnosed with a rare hereditary lung disease with an uncertain future? My daughter was born with a rare hereditary lung disease and received a double lung transplant at the age of 13. The disease is known as familial desquamative interstitial pneumonitis. My sister-in-law died in 1986 at the age of 26, leaving 2 young sons without a mother. My husband died in 2000 at the age of 42, leaving 3 teenage daughters without a father. My 35-year-old nephew has recently been diagnosed with this disease. He and his wife have elected not to have biological children. My mother-in-law watched 3 of her 5 children and her husband die from this disease. Today I am discussing 40 years of successful stem cell research, where stem cells come from, and I will show you a video on the tremendous hope stem cell research provides for families with histories of debilitating hereditary diseases. Stem cell research has been a controversial subject in the political realm for quite some time. According to the Boston Children's Hospital website, researchers have been testing stem cells for 40 years. Successful results of stem cell research include bone marrow transplants for leukemia, for lymphoma, and for severe combined immunodeficiency syndrome, as well as sickle cell disease and severe aplastic anemia. Everyone would agree these treatments options have proved to be successful and amazing. There are 3 types of stem cells: adult stem cells, umbilical stem cells, and embryonic stem cells. Promising research results indicates that healthy adult stem cells can be harvested, reprogrammed, and reinfused at the site they are needed. Future examples of possible treatments include spinal cord injuries and weakened heart muscles. The discovery that a single stem cell can divide to give rise to skin, hair, and oil glands suggests that manipulating them can provide treatments for burns, baldness, and acne. Patients unable to find matched marrow donor often use umbilical cord blood. The problem with this method is the number of stem cells in the umbilical cord is not sufficient, and when 2 cords are used, 2 separate immune systems battle with one another, which makes the transplant more complicated. Recent discovery of the use of prostaglandins show promise for providing the environment for umbilical stem cells to regenerate. While there is controversy regarding the use of embryonic stem cells, one argument worth considering is in vitro fertilization is legal and accepted by society. Frozen embryos not needed are discarded as medical waste. Why not use these for research instead? I know I struggle with the morality of the embryonic stem cells, but I fully support the use of umbilical stem cells and adult stem cells. Stem cell research provides hope for families with a history of debilitating hereditary disease. Please pause for a moment while we prepare for a video from Dr. George Daly from Boston Children's Hospital.
Which studies stem cell biology and in particular is aimed at improving.
We apologize for the delay. We have severe weather and the satellite is not recepting well.
Therapies for treating kids with genetic diseases of the blood. I get an enormous number of inquiries, emails, phone calls from patients with really devastating conditions. Spinal cord injury, cerebral palsy, Alzheimer's, diabetes, and more. And there's been an enormous amount of excitement that stem cells may offer hope for those patients, but it's very important to realize that those opportunities are in the future. Today, there are no established and proven stem cell treatments that work for things like spinal cord injury or Alzheimer's. The only thing that works today that we can be confident of is bone marrow transplantation. What I hear a lot about are families who inquire with the ISSCR about the various clinics that are offering very, very bold and potentially exciting new treatments. These clinics often are in locations like China or Russia or Caribbean or Central America, places that operate outside of the careful regulatory environment of the FDA or the EMEA in Europe. There has to be some independent judgment that the treatment is in fact safe and effective. This is an important protection for the patient. I struggle every day with the fact that we cannot cure all diseases. And I get appeals from very, very desperate families that they will do anything. They will go to any length. They'll pay any price. The concern is
Again, apologies.
That there are risks. There are risks from unproven treatments. There's certainly financial risks. What I can say is that there's tremendous excitement around stem cells. Stem cells.
Again, I apologize for all of the delays. We have severe weather and the satellite reception is interfered with. I do apologize for the delays.
Offer hope, but we can't take shortcuts to get there. And there is a process. There's a process that we're diligently attempting to follow, and that one day we do indeed hope to deliver real treatments. But the risk of subjecting your loved one to an unproven treatment at this time is very, very high. Unfortunately, with all of the hype around stem cells today, there's a lot of misrepresentation. And there's this urgency to commercialize. And unfortunately, that's fertile ground for exploitation.
We hope you enjoyed the video from Dr. George Daly from Boston Children's Hospital. We hope you found it very interesting. I do apologize for the delays. We are currently under a severe weather and our satellite continues to be interrupted. So a video that should have been 2 minutes did take about 5 minutes, and I do apologize for that. In conclusion, just my family has suffered incredible losses due to a hereditary debilitating lung disease. I want to protect future generations of my family and those of others. Stem cell research offers hope through the use of adult, umbilical, and embryonic stem cells. Surplus embryonic stem cells will be discarded as medical waste. We all need to prayerfully consider the morality of this option. However, I fully support adult stem cells and umbilical cord stem cells research for the purpose of helping and healing. Thank you very much.